Welcome everyone. Thanks for coming to our event. I have on my clock that is 5:58, so we'll get started in just a couple minutes. Okay, I think we can go ahead and get started. Um, okay, so good evening, everyone. My name is Jacqueline Mays. I'm a fourth year neuroscience PhD candidate at Baylor College of Medicine here in the Texas Medical Center. I want to thank everyone for joining us for our first session of our 5-part anti-racism teach-in series. So I'll say it's definitely unfortunate that we are hosting this series in response to the murdering of George Floyd by police, especially given that we've seen this story of police brutality targeting Black and brown bodies countless times. Given the huge response and traction that the anti-racism movement has gained, um, student groups from both Baylor College of Medicine and UT Health felt the sense of urgency to host this anti-racism series that could further delve into the ongoing injustices against Black communities and provide a toolkit for marginalized individuals and allies to help tackle systemic racism. So we also have initiated the Medical and Science Coalition for Activism, which I'll turn over to Aisha Khan to talk more about.
Hi, everyone. Again, thank you so much for taking the time to be here today. My name is Aisha Khan. I'm the outgoing president of the Association of Minority Biomedical Researchers at UT Health. In the last few years, students from marginalized communities in the Texas Medical Center have realized that as our communities have been battling new or continuing racist policies and systems, we've had to turn to each other and build solidarity on our shared struggles. So for example, student groups from UT and the Baylor College of Medicine came together to organize a vigil in solidarity with immigrants when the Muslim ban was first instituted. We also organized an international food festival in 2017, raising over $8,000 to support hurricane victims in Puerto Rico. And on June 9th, as many of you might know, we came together again to organize the scientists and health professionals for Black Lives to march against police brutality. But time and again, we've had to rebuild these networks from scratch whenever one of our communities was under attack. And we wanted to take a more proactive effort in maintaining solidarity across our communities and making sure that we always stay connected to each other. And that's why we're here today. So the Medical and Science Coalition for Activism, or MSCA, formerly known as TMCA, is an informal network and now hopefully a coalition of students and trainee groups representing marginalized communities as well as allies at the Texas Medical Center in different institutions. We wanted to build this network, again, to stay connected, to amplify each other's voices, collaborate interinstitutionally, share resources, and maximize on our collective efforts, and ultimately really to support each other and celebrate each other. And we've always had this network in some capacity. We've always wanted to reach across institutions and, as students of color, build. But this is just something that allows us to do that a little bit more easily now because we can stay connected. And in our process to put the series together, the So You Think You Can Be Anti-Racist series that we're here for today, we had to overcome a lot of institutional hurdles and a lot of roadblocks to be able to get speakers, to be able to make sure that we're able to support these speakers that are putting their time and labor and energy. So in response to that, we are going to crowdsource and fundraise for some of our later series. So we're going to post some of our links so you can keep up with all our work. And also, if you'd like to support this series, you can have a chance to donate as well. Thank you.
Okay, thank you, Aisha. So tonight we'll specifically be acknowledging racism and learning how to be a better ally, as many of us tend to think of racism on a purely personal level rather than an institutional or systemic level. So we appreciate every single one of you taking the time out of your evening to attend this seminar and discussion and being open-minded and willing to learn. So I first want to thank the students who worked tirelessly to take time out to organize this event, especially Miranda Lewis from BCM and Tracy Posey from UT Health, who helped contact Dr. Jones for this event, as well as BCM's Initiative for Maximizing Student Development Program for sponsoring this event. I also, just to address the viewers, please note that this session is being recorded and will be archived, and that you can submit any questions via the Q&A section at any time, and we'll ask them towards the end of the talk. So we're very excited to kick off our anti-racism series with Dr. Camara Phyllis Jones. So Dr. Jones is a family physician and epidemiologist whose work focuses on naming, measuring, and addressing the impacts of racism on the health and well-being of the nation. She is a past president of the American Public Health Association and was the 2019-2020 Evelyn Green Davis Fellow at the Radcliffe Institute for Advanced Study at Harvard University. She has taught at the Harvard School of Public Health, Morehouse School of Medicine, and Rollins School of Public Health, and served as a medical officer at the Centers for Disease Control and Prevention. Her allegories on race and racism illuminate topics that are otherwise difficult for many Americans to understand or discuss. Recognizing that racism saps the strength of the whole society through the waste of human resources, she aims to mobilize and engage all Americans in a national campaign against racism. So I hope everyone will join me in welcoming Dr. Jones. Thank you.
Thank you, Jacqueline. And I am so impressed actually with this student activism that you guys are engaged in. It's so important. And so I'm going to start sharing my slides, because what I want to do is equip this whole group with the tools for naming and addressing racism, not necessarily as allies. You know, when the organizers of this group came and they were talking about allyship, and I was like, it's beyond allyship, it's about partnership. But I'm going to get into that a little bit later. So you see, I had to list all of the organizations of which I was aware that were coming together as part of this coalition for activism. I am just truly impressed. When I was president of the American Public Health Association 4 years ago, in 2016, I launched our association on a national campaign against racism. Not just our association, but communities and partners, and, you know, as many people as would join us in a national campaign against racism, which had 3 tasks: to name racism, to ask, how is racism operating here? Because you have to go beyond talk to identify the targets for action, and then to organize and strategize to act. So what I want to share with you in kind of the beginning of this, without time for interruption for questions, I'm just going to kind of go straight through so that we can have a very robust conversation for hopefully 30 to 40 minutes. So what I'm going to share with you for the first part are some tools for doing each of those 3 things: naming racism, asking how is racism operating here, and then organizing and strategizing to act. The first of my tools for naming racism is one of my allegories, a teaching story that I've developed to help people understand that racism does exist. And all of my allegories are based on something that happened in my own real life. So let me just tell you. Okay, so years ago, when I was a medical student, a first-year medical student, I was very studious, hardworking. One Saturday, what was I up doing? I was up studying. And then some friends came over. And so what did we get to doing? We all were studying in my apartment. long and hard, and it got late and we got hungry, and I had no food in the apartment, which was typical for me. My friends understood. They were like, okay, never mind, Camara. Let's go into town and find something to eat. So that's what we did. We go into town, we find a restaurant, we walk in, we sit down, the menus are presented, we order our food, and the food is served. And here we are, eating. Not a very remarkable or illuminating story about racism, not yet. But as we sat there eating, I looked across the room and I noticed a sign, and the sign was a startling revelation to me about racism. And so now I've intrigued you, and you're like, Dr. Jones, what did the sign say? What did the sign say? The sign said, open. So now I know I've lost a number of you. So let me recap. Here we are, sitting in a restaurant eating. I look across the room and I notice a sign that says open. And if I hadn't thought anything more about it, I would have assumed that other hungry people could walk in, sit down, order their food and eat. But because I knew something about the two-sided nature of those signs, I recognized that now indeed the restaurant was closed due to the hour, but firmly closed. And that other hungry people, just a few feet away from me, but on the other side of the sign, would not be able to come in, sit down, order their food and eat. And that is when I understood that racism structures open, closed signs in our society. That racism structures, if you will, a dual reality. And for those who are sitting inside the restaurant at the table of opportunity eating, and they look up and they see a sign that says open, they don't even recognize that there's a two-sided sign going on, because it's difficult for any of us to recognize a system of inequity that privileges us. So, for example, it's difficult for men to recognize male privilege and sexism. It's difficult for white Americans to recognize white privilege and racism. In fact, it's difficult for all Americans to recognize our American privilege in the global context. But those on the outside are very well aware that there's a two-sided sign going on, because it proclaims closed to them, but they can look through the window and see people inside eating. So back inside the restaurant, to those who ask, is there really a two-sided sign? Does racism really exist? I say, I know it's hard for you to know when you only see open. In fact, that's part of your privilege, not to have to know. But once you do know, you can choose to act. So it's not a scary thing to name racism. It's actually an empowering thing. It doesn't even compel you to act, but it does equip you to act, so that if you care about those on the other side of the sign, which is an if, but if you do, you could even talk to the restaurant owner, who is, after all, inside with you. And you could say, restaurant owner, there are hungry people outside. Why don't you open the door? Let them come in. You will make more money. And oh, the conversations we could have. Or maybe what you'll do is pass food through the window. Or maybe you'll try to tear down that sign or break through that door. But at least what you won't be doing is sitting back saying, wonder why those people don't just come on in and sit down and eat. Because you'll understand something about the two-sided nature of that sign. So this story has been to illustrate for people who actually were born inside the restaurant and have only seen the sign that says open, to illustrate that yes, racism does exist. It's creating a dual reality or a multifaceted reality. It's not just the open closed sign, it's the sign, it's the door, it's the lock, it's all of that. And I actually started a 3-hour conversation once. You know, just like this is the first story I'm sharing with you. So I threw out the question to a community organization in Flint, Michigan, and we talked about this next question for 3 hours. The question being, how could people who are born inside the restaurant know something about the two-sided nature of that sign? Because there are many, many ways to know. I think that actually what's happened now in the last 6.5 weeks in our nation, maybe starting a little bit earlier with the very startling disproportionate impact of COVID-19 on Black and Indigenous and other people of color communities, right? But then with the cold-blooded murder of George Floyd on tape, you know, with equanimity, right? And the other murders that we had just seen recently, although they had happened 2 months before, of Ahmaud Arbery by a vigilante group, or Breonna Taylor, or Elijah McClain, we find out later, or Rayshard Brooks. So with all of these things, something has happened, some wind has blown or something has happened so that those inside the restaurant are, the sign moved in some kind of way and they got a glimpse of the other side of it. A friend told me that maybe it wasn't that like the air conditioning went on high and the sign moved. Maybe a brick came through that window and that caused a breeze. But for some reason right now, there are more people who are inside the restaurant understanding the two-sided nature of that sign. That is very encouraging. But what I need to say about that is the kind of baseline, staunch racism denial that characterizes this nation is so seductive that in 6 months, if you just say the words Black Lives Matter, or you just put the words together, structural racism or systemic racism, if that's all you do, then in 6 months, you're at risk of falling back into what I describe as the somnolence, the sleepiness of racism denial, right? If you don't want to fall back into that, then what you have to do is start acting. Because if you just say something, you can forget why you said it. But if you start acting, you will not forget why you're acting. So that's a very important kind of charge, my first charge to you. My second charge is actually try to remember this story, right? And try to share this with a roommate or a family member or maybe on social media. In fact, if you Google Camara Jones TED Talk, I did a TEDx Emory in 2014. And this story is the second of 4 allegories that I share in that TED Talk. But I owe you a definition of racism, don't I? I've said the word a bunch of times. When I say the word racism, I am clear, first of all, that I'm talking about a system. So I'm not talking about an individual character flaw or a personal moral failing or even a psychiatric illness, as some people have suggested, although racism can manifest in those ways. But in its essence, racism is a system of power. And a system of doing what? It's actually a system of doing 2 things, of structuring opportunity and of assigning value. And on what basis is the opportunity structured and on what basis is the value assigned? It's based on so-called race, based on the social interpretation of how one looks in a race-conscious society. That is what we call race. And just to give you an example, here I am, you're looking at me. In most parts of the United States, when you look at me, you're like, she's clearly Black, right? But if I were in some parts of Brazil, I would be just as clearly white. And if I were in South Africa, I would be just as clearly colored. So here I am, same physical appearance, but the social interpretation of my appearance in those 3 settings would assign me to 3 different racial groups. And furthermore, if I were to stay in any of those settings long enough, then my health outcome would take on that of the group to which I've been assigned, even though I'd have the same genes in all 3 places. And this is not just because of my kind of tawny skin. For every person within the sound of my voice, there is some other place on this earth where your so-called race, as you are living it today, would be something quite different. And so understanding that race is the social interpretation of how one looks, and that racism is the system that operates on that substrate of race to do 2 things, structure opportunity and assign value. What are the impacts of this system? Well, when we do think or talk about racism, which is until quite recently, very rarely, not often enough, but when we do, we understand that racism unfairly disadvantages some individuals and communities. But it shouldn't take us long to recognize that every unfair disadvantage has its reciprocal unfair advantage. So that racism is also unfairly, oh my gosh, there's like a super storm. I'm so sorry. I know you still can't hear the thunder, but there's a super storm going on right here. So if I flinch, you know, that's what's going on. That was like some really loud thunder right now, and it's very dark. But I digress. As I was saying, every unfair disadvantage has its reciprocal unfair advantage, so that racism also unfairly advantages other individuals and communities. And that's the whole issue of unearned white privilege that we hardly ever talk about in this country, because talking about it makes some people, especially some white people, uncomfortable. And I used to say, when I'm talking to groups, I would say, if you feel uncomfortable when I said those words, unfairly advantages or unearned white privilege, I used to say, shake it off, stay with me, I'll tell you some more stories. But you know, I stopped saying that about a year ago. And the reason I stopped saying that is because now I say, if you feel uncomfortable, you need to lean in to that discomfort, because for all of us, the edge of our comfort is actually our growing edge. But even as we recognize that racism is either unfairly disadvantaging or unfairly advantaging individuals and communities, racism is also sapping the strength of our whole society through the waste of human resources. And when we say that Black Lives Matter, it's not just that Black lives matter, Black lives are precious. Black lives are genius and leadership and creativity and warmth and generosity and love and all of these things. And when we constrain Black and Indigenous and other people of Latinx and Pacific Islander, Native Hawaiian, and all of these, you know, Asian, all of these lives that have been racialized in our society, when we constrain Black and other people of color and Indigenous lives, either slowly, by not vigorously investing in the full, excellent public education of all of our children, because the blinders of racism have made some decision makers think that there's no genius in the barrios or the ghettos or the reservations. We can get along very well, thank you, without those children, when of course there's genius in all of our communities. When we constrain those lives slowly, or we constrain them slowly because we've become complacent with what I describe as the wholesale warehousing disproportionately of so many Black and brown men in our prison system, or whether we constrain Black life a little more fast, a little more quickly, by being a little lackadaisical about the fact that COVID-19 is disproportionately impacting communities of color. Or we even constrain and snuff Black life faster when vigilante groups or people, you know, snuff out Trayvon Martin's life, or, you know, Ahmaud Arbery's life, or when the police who are charged to protect, you know, snuff out the life of George Floyd or Breonna Taylor, Elijah McClain, or so many others, little baby Tamir Rice, Sandra Bland, so many others that we can lift up, whether we do it slowly or whether we do it quickly. That is not just hurting the individual or that individual's family or even the communities from which they come. Those acts are sapping the strength of the whole society through the waste of human resources. And if we did not do that, who knows, we might already be up on Mars farming if that were a good idea. But we wouldn't even have to go to Mars. If we had all that genius and all of that talent and all of that human potential as part of our family in this nation, we could be solving the problems in our communities today. And that is why I don't even like to talk about allyship, honestly, because I don't think that anti-racism is a thing for the folks who've been unfairly disadvantaged only, and then I'm going to kind of try to use some of my advantage to help those people. Yes, we need allies to recognize their unfair advantage and then use it in the struggle. But honestly, it's not for somebody else's struggle, and it's not even so loose allyship that, well, you know, I have to go on vacation for 3 weeks, so I hope the struggle goes well, check you when I get back. It shouldn't be like that. We have to recognize that this system is sapping the strength of the whole society. So it's more of a partnership, I would think, than an allyship that we need to do, that this is our struggle. And we just have to recognize the different tools that each of us have in our toolbox in this common struggle. And the tools that white folks have in this common struggle is that they are given the benefit of the doubt and all of these other things, and they can speak to white people and be listened to more. I could tell you stories all night, and all a white person has to say in a meeting is, why did you ask that? Or why did you say that? Or why isn't so-and-so at this meeting? And it will have more power. I just want to say one more thing before I get off of this slide. And that is that there are many people in this country who think that there are two states of being, disadvantaged and normal. And the reason that there are many people who think that there's disadvantaged and normal is that we as a nation are ahistorical. And people do not understand that their so-called normal is built up on a whole mountain of unfair advantage. But now I want to, so I'm going to encourage you to, I'm going to take like a 10-second break. I'm going to have some water, and I want you to put some questions in the chat right now, because I'm going to shift gears into another interesting area. Hold on.
Hi, everyone. Make sure you're submitting questions in the Q&A box at the bottom. You're able to submit questions anytime during the webinar, and we will make sure we're keeping an eye on them and make sure we're moderating towards the end. So you don't have to forget anything that Dr. Jones says. Just whenever you have a question, go ahead and submit it.
Yeah, but sorry, I said chat. No, not chat. They don't want it in the chat. They want it in the Q&A. Okay, so I got that. Okay.
No, you're good. You're good.
Okay, so yeah, put them in the Q&A. It makes them easier to find for real. And I don't even know if you guys have the ability to chat right now. Sometimes when you're in a webinar series, you can't even do that. So now I want to shift gears. You guys are, kind of, medical and biomedical science and all of this. How could racism impact health outcomes? Like, how could racism turn into differences in the numbers of our babies who die before their first birthday by race or ethnicity? That is the infant mortality rate. Or even the numbers of our mothers or would-be mothers who die in pregnancy-related or pregnancy-associated deaths within 1 year of being pregnant. And I don't know if you know that the difference between Black and white or Indigenous and white maternal mortality rates is nationwide about 3 to 1, but in some places 8 to 1. Or how could racism turn into differences in the prevalence of diabetes or high blood pressure or heart disease or kidney disease, and all of these things which now are described as pre-existing conditions, which are making it more likely if you get the SARS-CoV-2 virus that you're going to die from COVID-19. How could racism turn into these health outcomes? And to understand that, I find it useful to think about 3 levels of racism: institutionalized, or what we're now describing as structural racism. I say now because this story that these levels of racism that I'm going to describe, and the story that I'm going to use to illustrate these levels, I actually published 20 years ago, and I've been telling the story for 30 years. So institutionalized is institutionalized or structural, one level. Second level, personally mediated, which some people describe as interpersonal, but I prefer to stay with that tongue twister phrase, personally mediated, because I am still understanding racism as a system. And this is the system mediated through people. And then finally, internalized. So I am going to define each of these levels briefly, share with you some examples of how they impact health, and then illustrate them with another one of my allegories, one of my teaching stories. So institutionalized structural racism, what is that? Well, that's the system, if you will. That's the constellation of structures, policies, practices, norms, and values, which taken together result in differential access to the goods, services, and opportunities of society by race. So this is the kind of racism that does not require an identifiable perpetrator, because it's been institutionalized in our laws and customs and background norms. This is the kind of racism that shows up as inherited disadvantage or its reciprocal inherited advantage. This is the kind of racism that shows up in terms of material conditions, as well as in terms of access to power. So examples include differential access to quality housing by race, or differential access to excellent educational opportunities by race, or differential access to equal employment opportunities, or even the same level of income at the same level of employment. And clearly these things impact health. Differential access to medical facilities, which could be differential access to medical facilities in terms of insurance access or physical access or even linguistic access. Differential access to a clean environment, and the very well documented disproportionate impact of disproportionate placement of toxic dump sites or bus transfer stations and the like in communities of color. And then when you get to power, differential access to power, that could be power as information, so health information or even information about our own histories. Power as resources, not just capital resources, the social networking resources, and power as voice in media, in government, and the like. And sometimes when I this slide up, people look at those top sets of examples of housing, education, employment, and income, and then they challenge me, excuse me, Dr. Jones, isn't housing, education, employment, income, isn't that what we call social class? Why do you have that on a slide about racism? Are you talking about racism, or are you really, really talking about social class? And that's an important question, which many of you might harbor deeply in your hearts. And so I need to answer that question, don't I? And let me do so with the first part of my answer being the observation that it doesn't just so happen that people of color in this country are overrepresented in poverty, while white people in this country are overrepresented in wealth. That's not just a happenstance. And for each marginalized or stigmatized or oppressed group of color, there's been some initial historical injustice. So for American Indians, for indigenous North Americans, that initial historical injustice was the taking of the land and the near genocide. And then the moving of the survivors to reserved lands, reservations, and then in some instances, something good was found under one reservation. Oops, you got to pick the people up and move them someplace else. Or for example, think about the people who lived in Mexico for centuries who never crossed the border, but the border crossed them, and they are now in New Mexico or Arizona. And their grandchildren, great-grandchildren are being harassed and even killed, right? And then we start thinking about migrant labor, for example, and how with, Chinese Exclusion Act, but Chinese laborers were brought here to build our railroads in this country they were unable by law to bring their families and unable by law to marry. And then start thinking, oh yeah, and what about the internment of Japanese Americans during World War II without the concomitant internment of German Americans or Italian Americans? And then think about people of African descent, where the initial historical injustice was the kidnapping of West African people, our importation across the Atlantic with tremendous loss of life in the Middle Passage. And then for the survivors and their progeny for generations and generations, what I describe as the coerced usury of our unpaid labor for centuries to build this country. And then some people say, oh, but Dr. Jones, there you go talking about slavery. Dr. Jones, we all know that slavery was an unfortunate chapter in our nation's history, although maybe we all know that, and maybe we don't all know that, because some textbooks don't even talk about it that way, right? I know you guys are in Texas. So, but some people have said, we all know that that was an unfortunate chapter in our nation's history, but Dr. Jones, they will say, the enslaved people were emancipated by 1865, and we are currently in 2020. That makes that 155 years ago. So Dr. Jones, all else being equal, don't you think that the impacts of slavery would have washed out by now? But the answer to the question is in the key phrase that was in the question, all else being equal. And all else has not been equal since 1865, and all else still is not equal today. And there are what I describe as present day contemporary structural factors that are part and parcel of institutionalized or structural racism. So when you ask me, am I talking about racism, or am I talking, and I say it's part of, those contemporary structural factors are perpetuating that initial historical injustice and all of the others that we've described. So that when you ask me, am I talking about racism or am I talking about social class, my answer is that structural racism explains why we even see an association between social class and race in this country. This is a very important aha. It doesn't just so happen. Now I need to also say that sometimes people will say, well, Dr. Jones, you're so concerned about racism. Guess you don't care about poor white people. Well, that's a wrong assumption. I care deeply about poor white people, poor Black people, poor Latinx people, poor indigenous people, poor Asian people, poor Native Hawaiian, other Pacific Islander people. I care about all poor people. And we need vigorous anti-poverty strategies. But even if you were to give me a magic wand today and I could go and equalize income and even wealth today, if I did not address the background, structures, policies, practices, norms, and values, the mechanisms of institutionalized or structural racism, even if I equalize things today, in one generation, we would start to see a stratification by race again in terms of income. So this is not an either or proposition. This is a both and. We need vigorous anti-poverty strategies and vigorous anti-racism strategies if we want to put things right in this country. One more thing before I leave this slide, which is to say that structural racism can be through acts of doing as well as acts of not doing, acts of commission as well as acts of omission, and very often it shows up as lack of action, inaction in the face of need. I won't speak so long on each of these other slides because I'm so interested in getting around to your questions, but I'm good on time right now. So the second level of racism, personally mediated racism, I define as differential assumptions about the abilities, motives, and intents of others by race, and then differential actions based on those assumptions. So this is what most people think of when they hear the word racism, that somebody did something to somebody. It includes the different idea, the prejudice, and then the different action, the discrimination. And, you know, we have a lot of interest and acknowledgement now about implicit bias, as well as explicit bias, you know, unconscious bias as well as conscious bias. So all of that is in here. How can it impact health? Well, police brutality, I've already talked about that. We can't talk about it enough. And I charge each of you to just remember or research 5 people's names who've been killed, 5 Black or brown or indigenous people who have unarmed been killed by police officers. I have a list of about 40, and I used to carry them all in my name, but I'll say some more. Walter Scott, and you know, in Chicago, walking away, 16 shots, 16 times, starts with an L. Well, see, so my brain is overloaded right now, but I charge you guys to at least remember 5 people that you can, in addition to the ones that I've already named. Physician disrespect, which can be as subtle as a physician not giving the patient a full range of treatment options because the physician figures that the patient wouldn't understand, wouldn't comply, couldn't afford, or whatever they assume. Or it could be as blatant as sterilization abuse, which has had many iterations in our nation's history. Shopkeeper vigilance, being followed around in stores, or waiter indifference, not getting quick, respectful treatment, which is what most people think I'm going to talk about when I do my dual reality story. But those are real things that happen. Those are part of what some people call everyday racism, the microaggressions, the subtle communication of disrespect, which probably relates to elevated blood pressures in communities of color, blood pressures that don't even go down at night. And then teacher devaluation, which is a very important manifestation of personally mediated racism, because if a teacher looks at a young child and thinks that child can't learn and puts them off in the attention deficit disorder track, that child will never even know their full potential, much less have the opportunity to develop to their full potential. Now, this level of racism, like for structural racism, can be through acts of doing, acts of commission, as well as acts of not doing, acts of omission. But even more important is to recognize that personally mediated racism can be unintentional as well as intentional. You do not have to have intended to do something racist to have had a racist impact. The third level of racism, internalized racism, I define from the point of view of members of stigmatized races as acceptance by members of stigmatized races of negative messages about our own abilities and intrinsic worth. But I also acknowledge, as many of my friends who do anti-racism training have asked me about, Camara, what about the internalized sense of entitlement that many white people walk around with? Isn't that also internalized racism? And I agree it is. I actually never put it on my slide because I couldn't understand how a sense of entitlement could turn into bad health outcomes. But I think actually a sense of entitlement thwarted might be at the base of what some people are describing as the diseases of despair in white populations. So the suicides, the opioid overdoses, and the like. But this slide is still from the point of view of members of stigmatized races, where internalized racism shows up as self-devaluation, feeling maybe I'm really not as good as, maybe I shouldn't try to graduate from high school or apply to that college or become a physician or a biomedical scientist, you know, try to get a Ph.D. Maybe I shouldn't try for that job or try to live in that neighborhood. It also turns into the white man's ice is colder syndrome. Now that phraseology comes from my parents' generation. And what it meant then for people of color, it still means for many of us today. So let me explain. Say I'm Black and I need a lawyer. I might actually go and seek out a white lawyer over a Black lawyer. Or if I'm sick, I might prefer the white doctor over the Black doctor if I could find one. Or if my lemonade were warm, I might go way down the street to get the white man's ice over the Black man's ice, deeply believing that the white man's ice is colder, deeply internalizing the myth of white superiority. Internalized racism turns into resignation, helplessness, hopelessness, which turns into a lot of self-destructive health behaviors. It also turns into not registering to vote, or not voting even if you are registered. And come on, people, we need to stay on top of our registration status and those of all of our family and friends and people we don't know, and all of your fellow students and everything, because there's so many efforts to disenfranchise people in this election. We cannot let that happen. But internalized racism really is about members of stigmatized races accepting the limitations to their own full humanity of the box into which they've been placed. So that when you hear young high school students of color, and one of the friend group is trying to be the valedictorian, and the others are teasing her or him by saying, well, you know, so-and-so is just trying to be white, we need to challenge that. Because since when did white people claim exclusive access to excellence? They did not. So now I'm going to illustrate these three levels of racism with another one of my allegories. I call it my gardener's tale. So I'm going to actually stop sharing right now so that you can see me big as I tell this story, and then I'll go back into the slides. But this story is based on something that happened in my own real life. So let me just tell you my real life experience, and then we'll make it a story about racism. So my husband and I had been married about a year, and we moved down to Baltimore so I could finish my PhD at Hopkins. And we bought our first freestanding house, cute little house, big wraparound porch with flower boxes dotted all over the porch. And we bought this house in October, so that's not really the time to plant in Baltimore. But when spring came, my husband, who loves to garden, ran out to our, porch, gonna decorate our cute little house with his marigold seeds. But then he ran right back in because he said, Camara, some of these boxes have dirt in them, but some of these boxes are empty. I need to go down to the gardening store. So he does. He goes down to the gardening store and he's hauling back big old bags of potting soil. And then we take that potting soil and we fill up the empty boxes. And then we take equal numbers of our marigold seeds and we put them in all of the boxes and we water all of the boxes equally. And because I am not the gardener in the family, by this time I am exhausted, right? So I'm just gonna sit back and be delighted. So about 3 weeks later, I'm walking out of my front door and I finally pay attention to these flower boxes on my porch. And what I saw made me literally stop in my tracks, because what I saw made me think that we had planted completely different species in some boxes versus others, because some of the boxes were full of plants and the plants were tall and vigorous looking. And some of the boxes just had a few plants in them and they were scrawny and scraggly looking. And then I realized what had happened. That potting soil that my husband had bought turned out to be rich, fertile soil, so that every single seed planted in the rich, fertile soil had sprouted. The strong seed had grown very tall and vigorous, but even the weak seed had made it halfway up. But that soil that we found in the boxes from before, that turned out to be poor rocky soil. And so the weak seed planted in the poor rocky soil just died, and even the strong seed in the poor rocky soil had to struggle to make it halfway up. And maybe some of you guys are gardeners. So maybe you've composted half of your garden. Maybe you've seen this image with your own real eyes. And the image, of course, is about the importance of the soil, the importance of the environment. But now I'm going to take that image and I'm going to make it a story about racism by introducing a gardener. So now we have a gardener who has two flower boxes, one which she knows to have rich, fertile soil, one which she knows to have poor, rocky soil, and she has seed for the same kind of flowers, except some of the seed is going to produce pink blossoms and some of the seed is going to produce red blossoms, and the gardener prefers red over pink. So what does she do? She takes the red seed, she puts it in the rich, fertile soil, pink seed over in the poor, rocky soil. And 3 weeks later in her flower boxes, she sees what I saw in mine. So in that rich, fertile soil, all the red seed sprouts, strong red seed, tall and vigorous. Even the weak red seed makes it halfway up. In the poor, rocky soil, the weak pink seed dies, and here comes the strong pink seed, struggling to make it to a middling height. And then in those flower boxes, those flowers go to seed. And the next year, the same thing happens. And then those flowers go to seed. And year after year after year after year, the same thing happens until finally about 10 years later, gardener's looking at her flower boxes and she says, you know, I was right to prefer red over pink. So let's interrupt the story there to say that the first part of this story is how institutionalized racism works, where you had the initial historical injustice of the separation of the seed into the two types of soil. You had the contemporary structural factors of the flower boxes keeping the soil separate, and then through lack of action, inaction in the face of need, perpetuation of the inequity. But let's pick the story back up and say, okay, well, where is personally mediated racism in this garden? Well, the gardener's looking at the red flowers and thinking, oh, those red flowers are so beautiful. And then she looks at the pink flowers and she says, oh, those pink flowers sure are scrawny and scraggly. So she plucks off the pink blossoms before they can even go to seed. Or maybe she notices that a pink seed has blown into the rich, fertile soil. So she plucks it out before that seed can establish itself, which is some of the anti-affirmative action stuff that goes on. And where would internalized racism be in the garden? Well, the red flowers are just living their lives, enjoying being red. Many of them not acknowledging or perhaps not even understanding that they're benefiting from enriched soil. The pink flowers are looking over at red thinking red is mighty fine and wishing with all their hearts that they too could be red. And here come the bees minding their own business, collecting nectar but pollinating. So here comes a bee into one of the pink flowers and then to another pink flower and to this pink flower, and that flower's like, get away from me, bee, don't bring me any of that pink pollen. I prefer the red, because the pink flower has internalized that red is better than pink. So now the question arises, what do we do to set things right in this garden? Well, we could start by addressing the internalized racism. So we can go over to the pink flowers. We can say pink is beautiful, power to the pink. And that is an important intervention. But if that is all we do, it is not going to change the situation in which the pink flowers find themselves. So you might say, okay, I understand that. Let's address the personally mediated racism. Let's have a conversation with the gardener, or better yet, let's have a workplace multicultural workshop for the gardener. It's all good. So we have our workshop, and in the workshop we say, dear gardener, would you please stop plucking those pink flowers? Maybe she will, maybe she won't. But even if she does, it's still not going to change the situation in which the pink flowers find themselves. If we really want to set things right in the garden, we need to address the institutionalized or structural racism, which means we have to either break down the boxes and mix up the soil, or if you want to keep separate boxes, that's all right too, although it makes it easier for that same gardener to keep segregating resources going forward. Which means that if you want to keep separate boxes, you must enrich that poor rocky soil until it is as rich as the rich fertile soil. And when you do that, the pink flowers will flourish to be looking beautiful, grand, and glorious, so that in that intervention on the institutionalized racism, you'll have also addressed the internalized racism, because pink will no longer be looking over at red, thinking red is better or wanting to be red. And in that intervention on the structural racism, you may also address the personally mediated racism. Now, the original gardener may go to her grave preferring red over pink, but her children who grow up and see the flowers equally beautiful will be less likely to have that kind of attitude. So this story has been to state, affirmatively state, that if we want to set things right in the garden, we need to at least address the structural or institutionalized racism. Good to address all the levels at the same time, but we have to at least address the institutionalized racism, and when we do, the other levels may take care of themselves. But there's one more question in relation to this story, so I'm going to start sharing my screen again. And because I know how Zoom is, I can't just start where I left off or it will freeze. So I'm going to have to do this thing. And hold on, let's clear the screen. So here's the question that I haven't even asked yet, which is, who is the gardener? After all, the gardener is the one that I gave the power to decide, the power to act, and control of resources, which are actually the elements of self-determination, right? Who is the gardener? Well, government is a huge part of the gardener, but not the only part. So media, foundations, corporations, health centers or medical centers, or communities, to the extent that they have self-determination. But whoever the gardener is, it is dangerous when the gardener is allied with one group. I painted her red, that's why she prefers red over pink. And it's also dangerous when she's not concerned with equity, when she can look at her flower boxes and think that her garden is beautiful, thank you, because she's not even counting the pink flowers as part of her garden. And so our challenge is, what do we do about the gardener? Do we make the gardener striped or polka dotted or fuchsia? Do the pink flowers have to grow or recruit their own gardener? Lots of questions can come out of this story. And I am going to reserve some time for us to ask those, but I want to share two questions that have come before. One is, Dr. Jones, excuse me, but why should the red flowers share their soil? When I heard that question, I loved that question because it showed me the power of this story to start conversations about racism that might be otherwise difficult if we were talking about racism between you and me. My answer to that question, why should the red flowers share their soil, is that actually that soil doesn't belong to the red flowers. It belongs to the whole garden. Here's the second question I want to share with you. What if that's not the original gardener we're looking at right there? What if that's the gardener's great-great-great-great-grandchild? Here we are. And the great-great-great-great-grandchild has always seen the flowers looking like that, may not even think there's a problem to be solved. So very quickly, in three parts. First, we need to make the differences in the height and vigor of the pink and red flowers a problem requiring urgent solution, which requires us to understand that the pink and red seed were seed for the same kind of flower. So we have to reject all these notions of biological determinism that sometimes creep into our science and our medical studies, that there's some kind of genetic basis to what we see in terms of the differential expression of height and vigor of these flowers. So first we need to make the differences in the height and vigor of the pink and red flowers a problem requiring urgent solution. Then how do we solve it? Number two, we need to make those flower boxes transparent. We must be talking about the differences in the quality of the soil. And number three, as we make those flower boxes transparent, we must be sure that everybody understands that the pink seed did not just go launch themselves into the poor rocky soil. So we must talk about history, and we must talk about the gardener's initial preference for red over pink and how that set up the whole situation, which some people call cultural racism. In our setting, it is white supremacist ideology. We must acknowledge and address that, because if we don't, even if we were to compel that red gardener to enrich the poor rocky soil today until it was as rich as the rich fertile soil, if she continues to prefer red over pink, she will continue to privilege red over pink going forward. So when I defined racism earlier as a system of structuring opportunity and assigning value, we need to address both of those things. So I am going to just whiz through the rest of my slides. I have about 7 minutes. I hope I'm not speaking too quickly for anybody, but I really want to have about a half an hour for our questions. So I said I was going to give you tools to name racism. So, you know, the dual reality story, the definition of racism as a system, the 3 levels of racism, the Gardener's Tale, which I hope you will also remember and share, or you can get the 4-page paper that was published in the American Journal of Public Health in 2000, or you can Google Camara Jones Gardener's Tale and, you know, get an 18-minute video from 2002 from CDC. But anyway, there's lots of ways you can share it. But now the second of these 3 tasks for a national campaign against racism is to ask this question: how is racism operating here? Which is a legitimate question, because racism is not a miasma or, you know, a cloud that we can't get a handle on. It is a system with identifiable and addressable mechanisms, which are in our structures, policies, practices, norms, and values, which are different elements of decision-making, where structures are the who, what, when, and where of decision-making, especially who's at the table and who's not, and what's on the agenda and what's not. And anytime you find yourself at a decision-making table, I charge you henceforth, a second charge, to take a look around and say, who is not here? Who has an interest in this proceeding? And then your job is not just to represent their interests. Your job is to actually create space, find them a way to the table. And if structures are the who, what, when, and where of decision-making, policies are the written how of decision-making, practices and norms are the unwritten how of decision-making, and values are the why. And so I want you to take this question: how is racism operating here in my child's school, in my program, in this city, with regard to police killings of unarmed Black and brown men and women, with regard to the disproportionate impact of COVID-19 on communities of color. So I'm going to very quickly give you some examples of how you can take this question to identify levers for intervention. I'm going to race through this. So with regard to police killings of unarmed Black and brown men and women, structures include the presence or absence of civilian review boards to provide some kind of accountability mechanism for accountability of police actions. Policies include the use of the grand jury system in many places in this country, including in Atlanta, to indict police officers. So even of those officers, including the one who directly shot Rayshard Brooks, with the district attorney having all this evidence, until they are able to, after the COVID-19 restrictions are lifted, until they're able to impanel a grand jury, that man is not indicted. Practices of over-policing of communities of color, which result in more accidental interaction. The norms of the blue code of silence. If a police officer sees another one doing something wrong, the practice has been not to say a word, to say you didn't see anything. But actually, as a result of activism, now people in some places are being required to at least say something, and in other places, police officers are being required, if they see something wrong, to intervene. So that's progress. But that's a target for action. And then the values, we should target the value that views Black men as inherently threatening, because what that means is that a police officer who uses as a defense, I feared for my life, folks are like, oh, okay, I understand, I got that, he was Black, right? Now, in terms of the excess deaths of Black, Indigenous, and other people of color from COVID-19, before we look at the mechanisms in the decision-making processes, I just want to say that my analysis is that, first of all, we're more likely to become infected because we're more exposed and less protected. And then once infected, we're more likely to die because we're more burdened by chronic diseases with less access to healthcare. So how is racism operating here in all of this? Well, we're more likely to be exposed. We're more exposed because racial segregation of housing, first of all, in our housing, you know, more crowded housing, more multi-generational, but then it also results in racial segregation of education, which then results in racial segregation in terms of occupational ability and stuff like that. So we're more in these frontline jobs, right? And without wealth and without paid sick leave, without family medical leave, forced to work in the meatpacking plants, all of this, right? So all of that makes us more exposed, and even disproportionate incarceration in our jails, prisons, in our detention centers. A lot of these structural things make us more exposed. But why in those exposures are we less protected? Well, even for low-wage workers who are now deemed essential, there's very limited access to personal protective equipment. And as I said, limited paid sick leave and the like, no, you know, hazard pay, none of that. Even for unhoused people, you know, some are trying to get, you know, being provided housing, but in the jails and prisons, nothing there, no water to wash your hands with on the reservation. You know, in Navajo Nation, you know, 1/3 of families live without running water, all of that. Practices, including how testing, especially at the beginning, but still was mostly in affluent areas, drive up requiring doctor's orders. Our strategy, I could go deep on this, so maybe in the Q&A, our strategy, which is still mostly focused on symptomatic people, on documenting and, you know, the diagnosis, as opposed to doing a kind of, that's a very narrowly focused on the individual approach. That's a medical care approach to this pandemic, as opposed to a public health population-based approach where we might have public health surveillance that would pick up asymptomatic and symptomatic people. That's a long discussion. But those practices make the whole pandemic rush like a fire, you know, a forest fire just moving across the nation. And as that fire moves, it continues to disproportionately impact Black, Indigenous, and other people of color disproportionately. The norms of that support racism denial. So our narrow focus on the individual, ahistorical stance, the myth of meritocracy, I'm going to talk about those in a little more detail, and the values of how we differentially value human life based on work role or age or the existence of chronic diseases. So if we bake those things into our crisis standards of care, what do you do when you only have one ventilator and you have 8 people who need it, or one ECMO machine, or, you know, limited emergency dialysis and the like? And when these crisis standards of care are building in some of these differential valuations like that, you're at high risk of building in structural racism to further disadvantage people who've already been disadvantaged by living in disinvested, poisoned, highly segregated communities. So I just want to say that the definition of racism I gave you can be generalized to be a definition of any system of structured inequity. So what is sexism? It's a system of structuring opportunity and assigning value based on gender that unfairly disadvantages some, unfairly advantages others, and saps the strength of the whole society through the waste of human resources. And there are many axes of inequity operating in our society, intersecting in communities and in individuals. And all of these are at least risk markers for how opportunity is structured and value is assigned. As a smaller group are also risk factors in the progression to disease. And so you might well ask me now, well, Dr. Jones, if you recognize all of this, why are you so focused on race as the axis of inequity and racism as the system of structured inequity? My answer is that racism is foundational in our nation's history, and yet many people are in staunch denial of its continued existence and profoundly negative impacts on the health and well-being of the whole nation. I think that all of us, therefore, need to become actively anti-racist, even as we also engage in struggles around these other axes of inequity. And to the extent that we're able to dismantle the mechanisms of racism, all of those other struggles will benefit as well. A three-part definition of health equity, which I'm just going to glance over. What is it? How do we get there? How's it related to health disparities? You can ask me about this if you want to know more. I define health equity as assurance of the conditions for optimal health for all people. That is in contrast to how Healthy People 2020 defines health equity as attainment of the highest level of health for all people. I agree that that attainment is our goal, but I don't think it's a useful definition for health equity, because what if we magically hit that last Sunday? Are we done? And I don't think that health equity is a kind of a one-time outcome. I think it's an ongoing process, which process assurance, which is one of the three core functions of public health identified by the Institute of Medicine, along with assessment and policy development. Assurance of what? Of the conditions for optimal health, for whom? For all people. How do we get there? Achieving health equity requires at least these three things: valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources not equally, but according to need. And how is health equity related to health disparities? Health disparities will be eliminated when health equity is achieved. Health disparities are the differences in the height and vigor of the pink and red flowers. Health equity is all about the soil and the water and the sunshine and all of that that came before. And these three principles for achieving health equity, if you want to ask yourself, is what I'm doing about health equity? I think you certainly need to be hitting at least one of those, but I think you actually need to be hitting all three. 7 barriers to achieving health equity. These first 3 and the last are really what make it so easy for our nation to stay in a place of racism denial. Our narrow focus on the individual makes systems and structures invisible or irrelevant. If you have other questions about the other things that I've written on these slides, we can go deep in the Q&A. We are ahistorical as a nation, and we act as if the present were disconnected from the past, and as if the current distribution of advantage and disadvantage were just a happenstance. We endorse the myth of meritocracy, that if you work hard, you'll make it. And I give you that most people who have made it have worked hard, although not everybody who's made it has worked hard, and we have very prominent examples of that right now. But even as I acknowledge that most people who have made it have worked hard, there are many, many other people who have worked just as hard or harder, who will never make it because of an uneven playing field which has been structured and in which is being perpetuated by racism, sexism, heterosexism, all of these systems of structured inequity. And when you deny those systems, when you deny racism, then you are endorsing the myth of meritocracy, which then blames people as lazy or stupid if they didn't make it. And you can deny racism in any number of ways. You can say, I don't think racism exists, or you could never say the word racism. You could be talking about implicit bias, unconscious bias, diversity, equity, inclusion, cultural competence, all kinds of things, disparities, disproportionalities, all of these things, race, important things to talk about. But if you talk about all of those things without saying the word racism, getting the ism part, which is the system part, if you talk about all those and never say the word racism in the context of widespread denial, which is our national context, then you are complicit with that denial. That's why naming racism is the first and necessary but insufficient step in our national campaign against racism. Very quickly, the myth of a zero-sum game, the myth of you gain, I lose. It's almost like people think that they don't want you at their potluck dinner because they think you're just going to come eat up all their food, and they don't know you're bringing pies and cakes and roasts because they don't even value you. The fact that we have a limited future orientation where the only part of the future that we can really touch today are the children and the planet. And we have disregard for the children in our family. Many American Indian nations, when they're doing decision making, think about the impact 7 generations hence. We do not. Many East African people greet each other, not, hey, how you doing, but how are the children? Hoping that your response will be all the children are well. We don't even ask how the children are, much less if we did, would we get the answer, all the children are well. And we have a very usurious relationship with the planet. Our myth of American exceptionalism, that we are so special and all that, which makes us unwilling to learn from the experience of others, which is showing up very big time right now in our massive failure in dealing with this COVID-19 pandemic. And then the 7th of these barriers, which is also underlying, this is part of racism, white supremacist ideology, which some people think is a lightning rod term, but it is not. All it is the false idea that there's some hierarchy in human valuation by race with white people at the top as the ideal or the norm. But this false idea of a hierarchy with white people at the top gives white people a sense of entitlement. It results in the dehumanization of people of color and fear at the browning of America, which is underlying a lot of our politics today. So to wrap it around the bend, what can we do today? Going back to that image with which I started, we need to actively look for evidence of two-sided signs. Is there something differential going on here by race, by language, by zip code, by immigration status and the like? We need to burst through our bubbles to experience our common humanity on the other side of town, because all of us is in a bubble of experience, and many of us do not know that just across town, there are people who are just as kind, funny, generous, hardworking, and smart as we are, who are living in very different circumstances. We need to recognize our common humanity in different circumstances, and actually institutions can do that. You guys are bubble bursting even among yourselves in the different institutions that you represent, but now you need to go across town. We need to be interested in the stories of others, believe the stories of others, and then join in the stories of others, not as allies, but as partners. And I'm so heartened at the mobilizations and protests right now, which are demonstrating that people get this point. We need to develop a sensitivity to the absence of who is not at the table, what is not on the agenda, what policies are not in place that if put in place would be quite useful and productive. We need to reveal inaction in the face of need, which is how racism operates. Structural racism operates mostly these days. But all the actions are not just on the part of those who are inside the restaurant. So on the outside, we also need to know our power. We need to recognize that action is power, and especially that collective action is power. So I will now stop sharing my screen. I'm delighted to have shared some of these tools, and now for the Q&A.
All right, thank you so much, Dr. Jones. I mean, that even for me, I was trying to take notes and keep up, but thank you so much. That was incredibly insightful, and thank you for breaking down all of these concepts in a really, really elegant manner to teach all of us, I think, what the systemic network of racism and how pervasive it really is. Before we start taking questions really quickly, I want to thank everyone for being here. And also take a minute to acknowledge the racist trolls that appeared in our chat box earlier today.
Really?
Unfortunately, that is a reality for many of us, students of color. In the Texas Medical Center created this coalition and network for that exact purpose. As we navigate our academic institutions, we also at the same time have to fight for our communities. We're training to be scientists and healthcare professionals, but we still have to face, as Dr. Jones just talked about, institutional, individualized, and internalized racism that we're entangling. And we have to advocate for our communities. So student activists do face a lot of backlash, and it's natural. And we sometimes get used to it, but we do have to overcome a lot of institutional hurdles. And many of us, including a lot of the people that put this event together, have faced racist violence, as we've even tried to talk about what our communities go through. So all the while, we feel alone and separated from each other. So the coalition is a genuine effort to make sure that we're supporting our collective mental health, physical health, overall well-being, and make sure that we're not alone, and make sure that our allies have a space to build and advocate with us. I know this kind of network has never existed, connecting marginalized students and trainees in the Med Center before, but I do hope everyone here, especially our allies, faculty, admin, and staff from our schools, see why it does need to exist, and why you need to support us and stand with us, because we can't do this alone. Again, make sure that you're following along with our work, and I'll now hand it over really quickly to Jacqueline, who will be moderating the questions.
Okay, if you're ready, Dr. Jones, to take questions.
Yes.
Okay, so the first one I have here is, do you have any allegories or ways to approach white people who don't feel they have been at the table of opportunity, experience hardships, and therefore resist that there's systemic racism and the existence of white privilege?
So wait, so these are the people who grew up in Appalachia or something, so they themselves feel that their whiteness hasn't protected them? Is that the question?
Yes.
Right. So yes, I don't have the allegory for that yet, although those their whiteness. So I have two examples that not allegories. The first is going to be just talking about when we were at the Centers for Disease Control and Prevention, where I was for 14 years. And you guys need to check out the letter. I hope you guys have seen the letter from Inside CDC, where they're talking about just the oppression that you guys are experiencing there, but folks inside CDC. But we were there, we had this project, we were going to be training poor Black and white women in North Carolina. So CDC was going to go do a little show and tell in North Carolina. I wasn't able to go, so I was going to give my 5 slides on racism to my good friend, white female colleague, saying, would you please share my slides with them? She said, Camara, why do you want me to talk about racism when the one thing that they all have in common is that they are poor? To which my response was, well, they're all poor, but they have 2 things in common. They're all poor and they all live in a racist society, but they experience that second thing differently. And even when we look at the experience of poor white people who are more likely to live in mixed income neighborhoods as opposed to poor Black people with the same income in poverty. So there's a lot of data around that. So that's the first thing I want to say, is that even the experience of poverty is not the same if you're Black and versus white. But the other thing is, so you guys really will remember McKinney, Texas, which is what, just outside of Dallas. You remember about 6 years ago, I think it was now, there was a group of young teens who wanted to celebrate one of their 13th birthday at a pool in the neighborhood. So they all go to the pool. The people who were there at the pool did not want them there. And they called the police on them. And what we saw was a young Black woman being pulled by her hair by a police officer who then sat on her. And we saw young Black men sitting on the curb with their hands handcuffed behind their backs. And I asked people, how do we know about that thing happening? And people were like, oh, well, social media. But I said, but how do we really know? I found that answer out the day after it happened when I was watching national TV and I saw this young white boy saying, it was almost as if I were invisible to the police. He was part of the friend group. He saw what was happening to his friends. He could have run home for safety, but instead, recognizing that his white skin privilege made him almost invisible to the police, he stood up there and videotaped what was happening to his friends. This is what I have to say to you. You cannot, if you are living as white in this country, you cannot strip yourself of that privilege right now. You're getting the benefit of the doubt and higher expectations and all that. You are getting that right now. You cannot strip that. But what you can do is use it. And that is your job right now as an ally, but I hate that term, as a partner in this struggle.
So our next question, how do you navigate institutional backlash in academia, especially for students who are activists, but often at the lower end of the power dynamic? And how do we get through to faculty and admin who might be unaware of the necessity of activism, even in the framework of academia?
I'm hoping that there are at least some administrators and admin who in their day were activists, and maybe they're the ones who are here right now on this thing, because it is quite useful to have some kind of backup, some kind of cover. But it's also important not to be the only one. So the fact that you guys have come together in this collective is very important. What I would say to you is you need to institutionalize that in some way. I don't know if there's a way of formal groups, who actually get money from the institution. You guys need to apply in all of your different settings to make this something, because often faculty, if there are so many people that they can't just pick you off one by one, they will just wait you out until you graduate, right? And so what I have to say to you all is you need to institutionalize this effort right now, have some kind of bylaws, whatever you need to do. And then I also talk about geese flying. So, I don't want to spend so much because I want to hear more of the questions, but remind me, there are 2 stories I want to tell you guys before we get off. My goose formation thing is a little relevant to that question, but we'll make it relevant to another one. And also my cement factory. So I want to tell those 2 stories before we go.
Okay, that sounds good. The next question, how do we ask questions without making people of color feel like they have to act as the mouthpiece of people of color and or relive past trauma?
Read. I think you can ask your friends, and your friends, if they're not tired, like I'm really tired right now, and it's not even people asking me stuff, but it's like organizations. All of a sudden, I've been doing this work for decades, and all of a sudden people are so interested. So, so you don't want to wear your people out. So you can read, you can ask your friends, or you can use your eyes, or you can venture across town, or as I say, if you're interested and then you believe and then join in the stories of others, people, if you evidence that you're not just voyeuristic or trying to, learn something a lazy way, but you're really going to be part of the struggle, then people will welcome your interest because they'll understand you're trying to understand your struggle, not my struggle, right? As long as you approach it that I'm trying to understand because I recognize this is our struggle, it makes it a lot less tiring.
So this next question is prefaced with, please correct me if I'm wrong, but historically scientists were instructed to find biological or genetic differences between white people and people of color to justify slavery and the poor treatment of people of color. This perpetuated white supremacy and racism. Today, scientists continue to study the biological and genetic differences between races, and I feel this contributes to our understanding of health disparity. Is this still perpetuating white supremacy, and should we think about this differently?
We should definitely think about it differently. I don't mind, for example, you know, genetic studies and all, but we should never think that genes are race. I mean, never, ever, ever. So we can study genes and disease, but that is never race. We have mapped the human genome. There is no basis in the human genome for racial subspeciation. Now, the experience of being racialized and then the, you know, with differential opportunity structures and differential value assignment, which is internalized and all of that, that this has impact on our bodies. But I think of this way, if the kind of research we need to be doing is not even documenting the impacts of racism on health, is not what are the differences between Black and white people. We need to be doing intervention research. We need to be investing in schools and communities and say, well, this changed things. We need to be investing, we need to be enriching that poor rocky soil to see what is the impact. Right? We need to come from the stance that we understand that we're all human. I think that the more we just document the impacts of racism on health, we're doing a kind of US public health service on untreated syphilis in the Negro male, which is known as the Tuskegee study, but that's the real name of the study. So I always say it so people hear the real name of the study. We're doing that now. We're doing a natural history of racism. Let's try some intervention. Let's say, is this penicillin for racism right now? This investment in schools, and then doing that kind of work. So, but the reason that people don't do that is that we're so narrowly focused on the individual that we're much more interested in genes and things inside people when we have all the evidence that structures and systems are constraining health. And if we only would invest in those and changing those systems and structures, we already know that that would have an impact. So BIDIL, bad. I actually know a lot about that study. You know, all of these things, you know, different glomerular filtration rate things, bad. Different bone density standards, bad. Different, you know, lung capacity standards, bad. This is not like real. We are not different species, and you need to question, and you need to get all of the information you can. And if people are doing that kind of research, you need to ask the questions that will reveal those things for what they are. Right? It's not good science. It's documenting biological determinism, which is part of the white supremacist ideology.
The next question is, would you please elaborate on tangible action steps that us white people can take to fight systemic racism as to avoid falling back into the status quo within the next few months? So I don't know who's invited to be part of this collective, but you know, just become part of your own collective. If you're not part of this collective, then make your own white people, you know, collective on anti-racism. So start talking to other people. Don't do it as a solitary thing, because first of all, the somnolence of racism denial is so seductive that if you're just trying to do it on your own, you'll get confused, right? So you need to be in some part of group that's reading, that's studying, and then joining with others. Join real people's struggles. I would say right now, join struggles to protect the vote of all voters in this country. That would be, that's an action that all of us need to be in right now. Okay. The next question is, women of color leaders in social justice movements who are vocal often get vilified and labeled as extreme, angry. The activism label is used in a negative connotation. How do women of color sustain ourselves and deal with this, and how can allies help? Okay,
so this is my geese. Thank you for asking that question. So when you see geese flying, you know, you see them flying in a V formation, right? So the goose at the front, they fly that way because the goose at the front is breaking the wind for the ones behind, who are breaking the wind from the ones behind, and so forth. And I used to worry about that goose at the front. What's going to happen when that goose at the front gets tired? Because we don't want them to just drop to the earth or fly off someplace random. And they don't. They fly back to the back of the flock, and somebody else takes the lead. So what we need to do is to either identify or create our own flock. You guys are doing this in the collective, right? And then decide in which direction are we going? Are we going north or south? And then take turns in leadership. So that's one of the things, to become part of a collective. It doesn't have to always be on you. And you can learn so much more that way, but also, you know, the African proverb, if you want to go fast, go far. But if you want to go, I mean, if you want to go fast, go alone. But if you want to go far, go together. This is a long-term proposition. And you may feel like you have to strike out by yourself to go fast, but we have to have staying power, because this might be an intergenerational struggle still.
The next question is, how as scientists and future physicians do we address the scientific and peer-reviewed guidelines that perpetuate racism in medicine? And as a physician, how can I advocate for my patients?
There were some new guidelines, so I wish I could tell you now, but I saw something where I don't know if it was Lancet or somebody has new guidelines about addressing racism in papers. And so somebody has to just Google that and try to find out. But there's some new editorial guidelines that I saw about 2 weeks ago. You need to not get confused and not get pulled into it. And I have been working in this area for 25 years. When I was at Harvard School of Public Health, I was writing grant applications with the word racism in it. And people would call me on the side. They weren't supposed to call me on the side. Camara, can you change that word to discrimination? Because we'd like to fund you, but you know, can't fund it with racism. And I was like, no, I'm talking about racism. So after 6 years without that much funding, like one grant funded, then I was recruited to CDC. And so that was another good opportunity at the time. But so what I have done is I've taken my same agenda, and when the place becomes not conducive, I haven't changed my agenda, I've changed places. And so if you have enough power to understand that your work is important, and now everybody's saying racism, and now, you know, NIH has grants, you know, and funding opportunity announcements that are about racism and anti-racism. So you just have to be persistent in your work.
The next question, as a Latin immigrant, I recognize how blinded I was to racism growing up, thinking we were all the same and there was no racism in my country. How do we address the racism and anti-Blackness that exists within our communities?
You have to name it, first of all, including to your family members and where you see it. I mean, it's the three stages are really naming racism, asking how is racism operating here, and organizing and strategizing to act. And if you recognize the anti-Black racism, then maybe you can kind of build some of those bridges to bring people to decision-making tables and stuff where they are left out. So if you have some kind of lighter skin power or whatever, then use that privilege. But you have to name racism, you have to name colorism, you have to name all of those things, even in communities of color. It's real. When I was in Venezuela, the white Venezuelan medical students with me, you know, I was over there as a medical student, and they were like, there's no racism. And then the one brown-skinned sister was like, oh, au contraire, there's a lot of racism. And I could just see it because I could see how social class, you know, how the social class gradient was also colorized. So, yeah.
The next question, how do you have an open conversation with a person who believes police brutality or violent racist system against people of color is a myth, and show them it is not a myth without being dehumanized and getting riled up? It can be exhausting.
They need to read. So what do they need to read? And it's hard for people to read when it's going to challenge their existing views. On police violence, I read Just Mercy by Brian Stevenson, okay? And if you're interested in housing, then read The Color of Law by Richard Rothstein. And if you're interested in over-policing and you know, the prison industrial complex, then read The New Jim Crow by Michelle Alexander. And if you just want to understand what was happening in the South to North migration, read The Warmth of Other Suns by, Isabel Wilkerson. And just start reading a lot of things. Or start with my stories on videos. And actually I'm gonna write a book. And so maybe, you know, maybe my book would be the entry book. Maybe that's how I need to think about it. as the entry book for people who really want to understand, or they're going to be open to a little bit. My allegories are good for helping people. The open close sign is good for people to be like, oh, I never thought of it like that.
The next question, something racist that you have said, is it ever too late to bring this up?
That you said yourself? No, it's never too late because the other people heard it. And even though they might not have said anything to you, they heard it. So yeah, bring it up and say, you know, I said something here, and I understand what was wrong with it, and I bring it up. Please teach me. How might I have said it differently? Why didn't you tell me? Now you didn't care enough about me to say anything to correct me then, or you thought I was too fragile or whatever. You know, so have a real conversation. If you remember it, then address it, get it off your chest and learn something from it. Don't just say, okay, mea culpa, okay, bye, that was good. But learn, be willing to listen.
The next question, are reparations a step forward in healing the past actions? And what are your thoughts on reparations?
Necessary. So I actually think that I am intending that this nation does not stop naming that, double negative. So anyway, that we keep naming racism, that we don't stop naming racism, whatever it is. Anyway, so I think that the nation needs to have a national campaign against racism. And my 3 top policy initiatives for such a are reparations to descendants of Africans enslaved in the US, as well as honoring in the fullness all of the treaties with indigenous peoples. That's number 1. The second is decarceration, and as some people call abolition of prisons. Angela Davis has been talking about that for decades. And the third is massive investment in communities of color, in housing and green space and job opportunities and creating wealth and cleaning up the environment, all of those things, but especially massive investment around children and families, so early childhood education, all of these things. And we will know we will have succeeded when the term disadvantaged child will have no meaning. We will not even be able to imagine a child born into disadvantage or finding themselves in disadvantage. So, but yeah, reparations necessary, apology and reparations, all of it.
The next question, why do you think it is that people are more comfortable with activism, even at our universities and in medicine, when it comes to LGBTQ rights or women's rights, but not when it comes to Black rights?
Because when it comes to LGBTQ rights, they know somebody in their family. So for white people who know somebody Black or Latinx in their family, they're a little bit better, you know, they're a little more willing to learn. But many white people don't have anybody in their family who has come out as Black, right? But they have people who come out as gay, right? Or trans or whatever. So I think it's that. And that when you say the word racism, people think that you have called them a racist. When you're just talking about racism, people take it as a personal assault. And so now I want to tell my cement factory, because this is the story I tell to help with that. So imagine, I think of racism as a cement factory spewing cement dust. And if you're anywhere around this factory at any amount of time, you're going to have cement dust in your lungs. Right? And the cement dust in each of our lungs might affect us differently. The cement dust in my lungs might make me devalue myself. The cement dust in Derek Chauvin's lungs made him feel like he could, with impunity, crush the life out of George Floyd with his knee on his neck for 8 minutes and 46 seconds. But the cement dust, we each have some cement dust in our lungs if we're around this factory long enough. What are we trying to do, really? Do we want a machine that is going to scan people for how much cement dust you have in your lungs, and if you have too much, well, you have to go to jail, or I'm not going to talk to you, or whatever? Or do we even want a machine that's going to extract cement dust out of people's lungs while we still have this factory going on? Neither of those is really an effective strategy. What we need to do is recognize, first of all, that there's a cement factory going on. So when I recognize it, I need to put on a gas mask. That is, I need to start my journey of becoming actively anti-cement dust or anti-racist, knowing that gas mask is not going to withdraw all the cement dust I already have in my lungs, but at the personal level, I'm going to do this. Now, every time I see myself in the mirror or I put that gas mask on, it's going to remind me about the system. But it also, for my friends, they're going to be like, oh, what's going on, Camara? Why do you have that gas mask on. That's my opportunity to name the cement factory, name racism. Do you see that cement factory over there? And encourage other people to put on their gas mask. But it's not going to be that we want a lot of people, you know, walking around with gas masks. When there are enough of us and we figured out how the factory works, then we go in and we shut it down. So the problem is not the people with the cement dust, although they can be very problematic. But the real problem, if we want to set things right, is to go in and shut the cement factory down. When I'm talking about racism, I'm talking about the factory. I'm never trying to divide the room into who has more versus who has less cement dust, who's racist and who's not.
The next question is, what are effective mechanisms to implement mandatory anti-racism training in health professional education settings? How do we encourage those who have the power to implement them to do so, who may have always been inside the restaurant?
Right. Well, so now I think that the Association of American Medical Colleges, the AAMC, might be ready to come up with some some policies like that. And so to the extent that students and or faculty could reach out to the AAMC and ask them to do that for all medical colleges, that would be a thing. So the Accreditation Council of Graduate Medical Education has a learning collaborative right now on healthcare disparities, but now they're starting to talk about racism more seriously. I'm a faculty member on that learning collaborative. So you know, what we need to do, even the LCME, you know, the Liaison Committee on Medical Education, whatever, you know, all of these groups, these are the groups that have carrots and sticks that can mandate things. So you all as students organizing need to recognize that those are the agendas that you need to influence.
Okay, so we're actually at 7:30, but do you mind taking a few more questions?
I don't mind.
Okay, perfect. So the next one, epidemiologists use the terms race and ethnicity when stratifying data and reporting their results. How do we get away from these terms that do indeed suggest, especially to the general public, that some races are more predisposed to disease based on their genetic makeup, not the physical, economic, etc. systems that we've created to make them more susceptible?
So we need to make sure that people understand that race is not biology. So if you're writing a paper, you need to say that, and you need to vigorously investigate the root causes of any differences that you are finding and documenting by including other measures in your study. So if you think race is acting as a proxy for social class, you need to have some social class measures in your study. If you think it's acting as a proxy for culture, you need to have some cultural stuff and where were you born and where were your parents born and food and all that. If you think it's acting as a culture for genes, well, measure some genetics, but you know, I'm telling you it's not. And you need to introduce measures of racism because that's really what's happening. So the question, how do other people usually classify you in this country? Would you say white, Black, Hispanic, Asian, Native Hawaiian, other Pacific Islander, American Indian, Alaska Native, where you are talking first of all about how do other people usually classify you, not your self-identified thing, and also without making a false distinction between so-called ethnicity and so-called race, because Latinx as an identity is being racialized right now in our country. We're just pretending that it's something else, but that's what it's operating as. So using that question, for example, if you're doing your own studies, in addition to self-identified race ethnicity, would be quite useful. I refer you there to our 2008 paper in Ethnicity and Disease called Using Socially Assigned Race to Probe White Advantages in Health Status. It's Jones et al., 2008, Ethnicity and Disease. Look at that.
The next question, as a white physician, how can I partner and advocate for my patients of color who experience racism from either healthcare providers or the racism my healthcare colleagues experience as they practice medicine, aside from directly addressing each individual situation?
Well, so first you have to address each individual situation so that the person who's being traumatized doesn't feel like it's all on them and that you can see them. So, so every situation that you see, let your voice be the first one to bring it up because your voice has a different impact. And then maybe mandate the anti-racism training, mandate that people look at this video, you know, mandate other reading opportunities so that, that name racism and make it okay to call it when you see it, because now the whole institution is trying to become actively anti-racist. Make that an agenda thing. And then it makes it more comfortable to name things when you see them, and it also educates people. It's for the good of the whole.
The next question, can racism be addressed to someone without giving them an entire history lesson?
You can ask the question, why did you do that? Or why did you say that? And let them explain themselves. And then give some explanation, or like, did I offend you or something like that? And then you can explain yourself. But asking questions to bring things. I once at a pharmacy counter, some woman, I was invisible, I guess, and she just barged up and engaged the pharmacist. And so afterward, I challenged her. I said, you didn't say excuse me or ask if I had been served. And I said, oh, I didn't even see you. So here I am, not very big, but big as day, right? And I was invisible to her. So I did that in front of her son. I did that. Yes, I did. I went all over there. So, so just raise it up and ask people questions.
Okay, the next question. As you work towards making change and broaden a coalition meant to center marginalized voices and solutions with more diverse perspectives, how can you or should you avoid dilution of or compromising on your original goals?
You will not be successful in whatever your original goal is until you do what people call centering the margins. So here I give you the example of Minnesota. Now it might be the state, 95% white, and maybe their infant mortality rate as a state is good. But then there are big differences in terms of indigenous populations. There are even some of the, I don't know this to be fact, but it could be, you know, there's a lot of refugee resettlement and all, so I don't know those statistics. Until you know that you are all of it, you're not just the majority, right? And until you say, well, we have these disparities, we need to be figuring out and addressing those things, that's gonna make all of our statistics get even better. You have to understand that you have to, what people call center the margins. You need to make them the focus of the work. It's not like they are just too small to count.
The next question, there is so much evidence that science and medicine were used to perpetuate racism. This has led to a lot of medical mistrust in the Black community, especially, and a lot of these transgressions are not actually taught in school. How do you think the science and medical field can work better to acknowledge the past and start to regain the trust of the growing number of Black people who are turning away from traditional medicine and science?
So maybe the book Medical Apartheid by Harriet Washington should be part of the curriculum. Maybe the two books by Linda Clayton and Michael Bird, and I can't remember the names of them right now, but there's a double set of the history of race in medicine. Maybe those should become required text so that then for providers, so that they can understand what's going. But I think it's not even the history that makes people distrustful in their own interactions. It's like what happened last week when they went there, and then the receptionist didn't treat them right, or assume something about them, or the physician assumed something about them, or they weren't given the full range of treatment options, as I said. Or maybe it's when they were turned back from the emergency department with COVID-19 without a test to die at home. So it's not even that it's the history, it's like the current actions are still making people distrustful.
How can one point out microaggressions in a productive way that starts a conversation rather than making the microaggressor defensive?
By asking questions. What did you mean by that? I mean, I've done that when in airport lines and stuff. I just say, excuse me, I was here. Like when, so, I used to, when we were flying, I used to fly so much, I would be upgraded to first class a lot. And so then, the first class people, they line up to get up on the plane first. And then all these white men would always come up in front of me, right? And I say, excuse me, are you looking for the first class line? You need to get behind me. So you just have to, politely, but just correct people. You have to feel confident in your rightness, that your reality is a legitimate reality to act out of. You don't have to be apologetic. And I don't care if I made somebody defensive or not.
A lot.
I'm not tipping around trying to protect other people. No, let them tip around and try to protect me for once.
It's true. It's true. The next question. A lot of people believe that anyone with a title or authority in academic institutions means they automatically know more or know the best solutions for racial justice. And this often leads to student activists being ignored, infantilized, or dismissed when they have years of experience. How do we work with these power structures?
Mm. Whew. I don't know what to say. That sounds really rough, that you're not even respected at your level of being a graduate student. So I would try to find an ally, you know, or partner in the faculty, or even if there was an ombudsperson to bring that to the attention, because all of us need to know that each of us has something to learn, each of us has something to teach, and each of us has something to learn. And what often happens is that people who are at decision-making tables think they have all the skills and knowledge they need at that table, and they think if they let that student come in, well, that's nice. You know, or they let that brown or black person come in, or indigenous person come in, that's nice, but they don't think that they're really gonna add something, you know. And so I guess it's a big learning curve. And so the demonstration is when you add the person, then they demonstrate their value, but if they never get added to the decision-making table, bad decisions happen. So there has to be somebody on the inside. So often when we're trying to do things, it has to be an inside-outside game. You have to stay in touch, for example, with people in the community, or you have to stay in, and they need to stay in touch with people who are inside the institution. You need to have a friend on the faculty committee and the students, you know. So I guess without a specific answer, understand that you will always do better with an inside-outside game, and never isolate yourself just on the inside of anything, or even just on the outside of anything.
The next question.
How many more questions, Jacqueline? Just let me know.
I'm not sure, actually.
We can do like,
Oh, there are
you know, two, wait, let's do like, let's cap it. Let's do like 3 more. Is that okay, Dr. Jones?
Sure, because I haven't filed my taxes yet, and it's an hour later here, and it's getting late. So I've got to do this. I got to do this.
Okay, 3 more, because I am seeing there are a lot. There are a lot. Okay, the next.
And you might even send me the extra questions. I'm not saying when I might answer them, but at some point in the future, I might.
Okay, that would be perfect.
Okay.
This next question, in terms of allyship or getting people to join the good fight, I've seen many Black and brown people say that they are not concerning themselves with allyship anymore, either because they're exhausted or don't feel like allies really help. Do you think people should spend the energy trying to convince others to join the fight, or is that energy better spent on actually doing things for justice, such as protesting, voting, grassroots organization, etc.?
I don't think we should convince anybody. Anybody that you have to convince to join the fight, they're not there for the right reason. As I said, people need to come because they recognize that this is their struggle too, that they're not just trying to help you in your struggle. So yeah, that's waste of time and energy. And there are people who are awakening, and there are a lot of white groups trying to figure out what to do, and that's good. And then they can come and they can carry a sign, make signs, you know, they can, you know, it's as part of the struggle, not for you.
The next question, in the field of social work, there is a heavy reliance upon police. I understand the police to be a tool of supremacy, but many social work institutions do not want to admit that. Do you have any idea on how to challenge the status quo within academia and the general field?
Wow, I didn't realize that about social work. Because I would think that social workers would recognize that they're the ones who are better trained than the police to do social work types of interventions. And I think it's just that because social workers have not been supported in budgets, and the police have, that a lot of that work has gone to police. So I actually think that these calls to transfer money from police departments to social workers or mental health providers, or social services, is a good move. I actually didn't know that that was a thing about police and social work. So that's my best thing, is support investment in those who have the right tools for the job.
And the next question, I guess our last question, What are some strategies for exposing the realities of the generational effects of racist legislation and policies to someone who is either unaware of or in denial of such realities, even things like intergenerational trauma?
Well, my story, the Gardener's Tale, actually could be an illustration of that. And so I just want to end with this notion. When we compel the red gardener to enrich the poor rocky soil until it's as rich as the rich fertile soil, even when we do that, the pink seed that's already sprouted and is already blooming might grow up another little bit, but it won't be until those seeds fall into the rich fertile soil, that is one generation, that will see the real impact. So what it really is about is we need to do the interventions, but the interventions can't be with a 3-year or 5-year or even 10-year time frame. We need to do interventions where we're going to be investing in opportunity structures and in protection from risk and that kind of thing for a generation for at least 20 years. We need to have foundations and governments that will agree to do that without expecting to see the return while I can get reelected based on that. It's not going to happen like that. And so just even understanding it from the point of view of the Gardener's Tale might be useful. So that's what it is. And so it's not even about continuing to document the intergenerational trauma. Let's do some intervention research. Let's do some massive investment in communities of color. Let's do some reparations. Let's do some decarceration so that all of that talent that is trapped, all of the genius that if there had only been some other way wouldn't be even in the prisons in the first place, let them get out there and enrich this society, because racism is sapping the strength of the whole society through the waste of human resources. Let's stop that. So, final word.
Okay, thank you. I think that'll be our final question. I would say thank you so much.
Did you have one more, Jacqueline? You look like, oh, you took the question out of my mouth. Was there one more you wanted to ask?
Maybe, can I?
Yes.
Jacqueline, you can go. You put this together. You can ask your question, girl.
Okay, I kind of, so there are actually two that I wanted to ask, but one of them goes off of what we just mentioned. So I was wondering, how do you envision reparations occurring? So I guess there are different policies in effect. You know, some people will think that things like affirmative action are enough, for reparations, or do you see it as giving actual funding to large communities of Black and Brown individuals or individuals themselves? How do you see that playing out?
So first of all, everybody needs to read Randall Robinson's book, The Debt, from decades ago, and then also read William Darity and his colleagues' book, From Here to Equality, which was just published in March, I think. He's an economist at Duke, and his book is on reparations. So I haven't read his book yet, but I highly admire him as an economist. So I don't know what they're saying yet. My idea is that it's going to be both investment, so that it's going to be restoring wealth in communities and in families, and investing in business and investing in education, the wealth of our minds and all, so it's going to be investment in our human capital as well as in our businesses and in our communities, number one. But even if we did that as a one-off, and we didn't then have also power sharing in a way that we weren't actually in positions of power, even that wealth thing would wash out after a while. So it has, but I learned that when I was in New Zealand, Aotearoa, New Zealand, where they have a whole thing, I can't go, but they have a Waitangi tribunal looking at treaty breaches under the Treaty of Waitangi, and then an Office of Treaty Settlements, returning lands, or investing in broadband and that kind of thing, supporting the Maori language resurgence and that kind of thing. But even those kind of one-off investments without real power sharing, when the Treaty of Waitangi was establishing an equal partnership between Maori people and the British Crown, without that power sharing, all of that investment will wash away. So it has to be restoring the wealth when people of color built the wealth of this nation, as well as power sharing.
Okay, my very last question. It's a bit of a shift, but I guess I'm just wondering, with everything I'm seeing on social media, especially, I want you to kind of touch on how do we differentiate between performative acts versus actual actions that help dismantle systemic racism. We see these different actions of painting streets with Black Lives Matter versus white actors dropping down from their roles because they're playing a Black cartoon character, when, you know, we've continuously asked for the murderers of Breonna Taylor to be brought to justice. So what are your thoughts on identifying what is actual change versus what is just performative?
So I give a little bit of space to those who are doing the performative things, because those are the biggest steps that they can take right now, it seems. So I'm not mad at them, but they have to keep going. So they have to understand that whatever little step they did was good, but insufficient. And I even think that 24 counties and 42 cities, last time I looked, that have declared racism to be a public health crisis. And that's good, because it's a naming thing. We have to name racism. It's first, it's necessary, but it's insufficient. But at least those kinds of, when city councils or county commissions, it's not even the health departments in those areas, make those declarations, at least it puts them up for public accountability to then do more. So I take everybody's little baby step and then say, you're not done, you need to do more. So that's how I would take that yes, thank you, and.
Yes. Okay, thank you. I think that would be the final question.
Okay.
Thank you for letting us go over. I think we're over by 20 minutes now. But thank you so much for this insightful discussion. I think everyone on the call can equally say that we're definitely appreciative of your presence here today.
Thank you very much for inviting me, and thank you guys for being together and pulling this together. I'm just impressed with you guys, and keep on.
Thank you. Thank you.
Okay, bye. Thanks. I'm going to stay on smiling until we go off live on Facebook, because otherwise it's a little distressing, you know, when people just like disappear. Oh, okay.